Bridget's Cannabis Corner. We are live with Dr. Mark Ibsen today. We're going to ask him some questions, put him on the spot here. He's one of the brave physicians that has come out of the closet and said it's important for people to be given an alternative medicine to some very dangerous pharmaceuticals. People are being cut off of their medicines from the opioid crisis, just flat out cold turkey. In my opinion, I think it's because these physicians are scared. They don't want the finger pointed at them. They don't want to be blamed for this, when in fact that is exactly the case. But then they get scared and they're cutting people off. People are suffering terribly because of this. So first, thank you, Dr. Mark, for allowing
pleasure.
me to do this interview.
Glad
I really
to be with you.
appreciate it. Thank you. I've watched a lot of your stuff on YouTube. I'm really appreciative that you are a patient advocate, and you're kind of bringing the light to the fact that patients are being mistreated and neglected and abused.
Yeah. Well, I think we should stand by our patients, and patients are feeling betrayed and abandoned, and they're not getting their needs met, and they have to choose between Western medicine and an alternative. And I think we can integrate things, and it's really about the patient-physician relationship, which I think has been harmed, and we can get into that.
Yeah, I totally agree. And I'd like to make a point of that. Patients are being harmed this way. A lot of us still need those meds. A lot of us are dealing with chronic pain, and we're being treated like we're drug seekers or that we're doing something bad. Well, we didn't necessarily ask to have this medical condition, and we're being treated as though we brought it upon ourselves. And you're right, people are feeling abandoned and lost. In cases like that, when a patient feels hopeless and that their physician has let them down, what do you tell patients to do? What do you suggest they do in those cases?
Most people who are feeling betrayed and hopeless, they went to the Mayo Clinic and spent a lot of money, and then they're done, and they said they can't help you anymore. They've had 10 back surgeries, and the surgeon says, sorry, we can't help you anymore. They feel betrayed because they've trusted the medical system to resolve their problem. And don't get me wrong, our medical system creates miracles. We save people's lives. We're not so good at making sure that the life we've saved is worth living. And I think that's where people are feeling betrayed. I mean, if you have a great outcome from your surgery and you're on your way, and that's great, that's what all surgeons want. But every once in a while you get a complication or things get worse and pain increases, and doctors are now really terrified to treat people's pain. They're afraid of being arrested. So it's more the practical aspect of, geez, I can't help anybody from prison, so how am I going to keep my license and still help as many patients as I can? I can understand that.
Yes.
But I think our system fails patients at the realm of palliative care. Hospice care is if you're dying, and there's cancer patients that are being abandoned too. It's just crazy.
Yeah.
But when you've done everything you can to resolve an issue and it's still there, then it's time for palliative care. But we treat most medical chronic illnesses in a palliative way. There's no cure for hypertension. We give you a blood pressure medicine. There's no cure for diabetes. We give you insulin or metformin. So, there's no intervention that's going to fix that. But somehow in the pain management area, we've got this crazy idea that an intervention is better than a chronic medication. And that may be true and it may not be true. So I think oftentimes patients are they don't know where to turn. And so they end up here and they see me, and I can help them with the cannabis, but I can also help them every once in a while I'll find a patient and I just apologize to them. I'm a guy in a white coat, and I feel badly about what happened, and it's not fair and it's wrong. And sometimes it's sick and wrong. And at that kind of level, people feel acknowledged, at least, that somebody can see that it's not their fault, and that if they're only a better person, or if they were only smarter or more diligent or something, chronic pain is a spiritual conundrum. People begin to wonder whether it's worth living anymore.
Absolutely, because I think for me, just the thought of having pain that I cannot control, it creates a lot of fear in me. And And so that's when I put all my trust into Western medicine and physicians, because I believe, you know, they would have the answers. That's their specialty, that's what they do. And for me, they put me on a lot of medications that I had to raise 5 kids stoned out of my mind on pharmaceuticals. I worked 10, 12-hour shifts and went to school full time, and then went home and raised my 5 kids. And so I feel like I lost a lot of their childhood because I was so afraid of the pain and didn't know what to do, and didn't put the trust into myself and think, you know, maybe all these meds aren't okay. I had to find a solution in order to be able to function. And depression comes along with that. When you have a major medical diagnosis like that, that's going to affect the rest of your life, you wonder, what's wrong with me? What did I do wrong? How could I have changed this? You blame yourself.
Yeah.
And so I'm really appreciative to you and physicians like you that are here for patients like us who need physicians that can empathize with patients. And I think that in Western medicine, a lot of the physicians, they've lost that empathy, which is one of the most heartbreaking things for me.
Well, yeah, your doctor's not working for you anymore, essentially. Most doctors are employees, and our profession has become more like teachers, except without a teachers union. So your doctor is an employee of some big organization, and they can't afford to go offline or have the Board of Medicine look into them or something like that. So it's they're terrified and the patient's terrified. Because also, you know, when I first started, I graduated medical school in 1980, believe it or not. And when I first started, it was you, me, your attorney, and my attorney in the room. So that's the system I grew up in.
Yeah.
Now there were doctors then that was bitter about that, but I couldn't be bitter. I was just a newcomer, right? But now it's you, me, your lawyer, my lawyer, the DEA, a state bureaucrat, the Board of Medicine, your insurance company middle manager who you never really meet a face, you just talk to somebody on the phone, nurses, and legislators. And all of these people who know less about how to manage a medical case than I do are controlling the outcomes, and they're controlling what we can do for you. And instead of, you know, right medicine, right procedure, right herb at the right time that you and I negotiate together and we choose together as partners, it's now constrained in so many ways by what's going to be paid for, what's going to be approved, what's legal, what's not, what's going to risk my license, etc. So it becomes, you've become a threat to me as a patient. Not only that you might sue me, but that you might be a source of a complaint against my license. And I've had a couple of those, and I just got out of one yesterday. And you might be, you might be source of an investigation that the DEA does. You know, if you sell your pills and somebody dies, who are they going to blame? They blame me. It's like blaming a car dealer for selling a car to someone who might speed and run into somebody. So I often said to some of my opiate patients, you know, you take an overdose and die, you're going to kill you and me. Please don't, you know. And I had good relationships with my patients, and none of them did that. But 6 of my patients are dead now because of lack of access to the medicines that they needed and lack of access to me. So there's a lot of tragedy going on in medicine these days, and we need to put the heart back in it.
Yeah, and access, I think access is a really good thing. And that's part of what my people are facing, is they're not as progressed as Montana is, even though we are still limited by access. We can only go to our caregivers. So a lot of people don't have access to medical marijuana doctors. They only have access to primary care physicians or their specialists. And in those states where it's not medical, it's not recreation, we are finding most of those physicians are not even discussing cannabis with their patients because it's not legal.
Right.
So I had a couple questions for you. Would you agree with the statement that Western medicine is an ego-based society, or do you feel it's more like all those extra legal loopholes that are placed? Is that part of the monopoly?
Wow, great question. Yes. But you know, what creates more ego? Fear. What diminishes the ego? Love. You know, there's not much love in medicine these days, and we can bring it, but there's just so much tension, like I said, about the number of people in the room. There's so many threats. The Board of Medicine tried to take my license, and it was a 6-year fiasco. It could have been over in 10 minutes. We could have just had a conversation. And but no, they want to punish you until your morale improves. You know, it doesn't work. And yet, or you know, the arrest and conviction of Dr. Christensen in Florence. I mean, that was just a nightmare. And I thought he was a criminal at first. And I'm the one person in the state that saw his patients. 22 of his patients ended up coming to me when his clinic got shut down suddenly. But you shut down someone who's treating pain suddenly, and you create a bunch of opiate refugees, and that's what happened. And there's many of them around the state. And I think so. Patients are being terrorized. Pain's a fucking terrorist. Excuse me. And then now doctors are being terrorized. Doctor suicides have gone up. I mean, this isn't that satisfying to have to be, you know, when you went into medicine to try to help people, and then you find yourself constrained by being able to help, or worse yet, criticized or vilified for trying to help people, then it's a real struggle to maintain your own compassion under those situations. And there's no compassion when bullets are flying. You're in survival mode. And you know, some of my patients are suicidal, and I tell them, you know, if you're not suicidal, you're not paying attention. You know, you got to acknowledge that this stuff will make you crazy. And it's making doctors crazy too. And it's making them limited in terms of being able to be creative. And we went into medicine to try to create solutions for patients. And if we're thwarted in that, there's nothing more frustrating to someone who's as heroic as I am to be thwarted in how I'm trying to provide what I think is the best thing for my patients. So it's agonizing to be in this profession these days.
And you make a good point, because that's exactly why I came out of Western medicine. I morally and ethically cannot work for Western medicine, knowing what I know and knowing how some of these physicians have treated patients. So that's why I've stepped into cannabis, because it does allow me to spread that love and hope for patients, to let them know there is a safe alternative for you. But you made a very good point. It's not just people like me who are patient advocates, it's physicians who get into this. They spend a lot of money on school to try and get this rolling. They do it because they're compassionate, they're empathetic, they want to help people. And when you're restricted like that, it's very frustrating, very frustrating.
I think the only real healing thing is to create a context for healing, and that's in a conversation and being open with your patients, and then being willing to learn from them and to have them tell their whole story. We don't have time to hear your whole story anymore.
Yeah.
You know, I get the time in these kind of environments with cannabis, but in the ER, you got 90 seconds to come to a conclusion.
Yeah.
And so people complain about how they're treated when they go to the ER, and I'm an ER doctor, and I never liked that part of it. But I also thought it was more therapeutic to have a conversation even then, and to be honest with our patients, and hiding behind some saying that the government rules are making us do this. No, your lack of a spine is making you do this.
Good point, Dr. Ibsen.
But I really think this is such a complex issue that blaming doctors or doctors blaming patients doesn't come anywhere near a solution. In fact, the more they divide us, the more we're all suppressed.
Yeah, that makes sense.
And I think that, like for example, the opiate complexity, or people now call it opioid, which is a degradation in term. It's less specific. You know, it includes, you know, illicit drugs and prescribed drugs. So we should keep them separate, in my opinion. But I know what people are dying from. They're not dying from Percocet. They're dying from heroin, and I have never prescribed heroin. Yeah. And so, and I'm sure some of my patients have reverted to it because they couldn't find anything else. But, you know, heroin overdoses have skyrocketed, and in the last 6 years, we're now prescribing about 2/3 of what we were in 2010. So prescriptions are going down and heroin overdoses are going up. What does that tell you? It's not because of doctors prescribing. Yes, indeed, some patients divert, but the same theory goes with welfare patients. You know, you think that, oh, people on welfare, they're all scamming the system. And when they look It's about 3%, you know, and it's like, but 3% of a lot of sick people is still a large number. And patients might divert their pain medications. And now that there aren't any to divert, now the pain pills, the pills that you buy on the street are counterfeit. And they've got fentanyl in them and they could kill you. And it's like, who do you want managing pain? The doctors that have been trained, or the guy on the street who's gonna sell you what he can, and if you die, oh well. In fact, sales go up sometimes when dealers have a patient who dies. Because everybody thinks it's really strong stuff, so they want more of it.
Which is totally, I mean, and I think that proves that with people having these chronic medical conditions and being cut off their medications, people are left to seek their own care and self-medicate. And so I see a lot of people, like you said, heroin. Right now in our little town of Missoula, heroin has skyrocketed. This came directly from the police told me this. We're having a huge heroin problem here in Missoula. I was born and raised here. I never thought heroin would even be on our streets.
Yeah, so let's ask the question, why is heroin abundant and cheap?
Yeah.
Because if everybody's using it, the cost ought to go up.
Mm-hmm.
You look around and you go, oh, it must be the doctors. Well, and because we did prescribe more opiates since 1999, you know, the fifth vital sign, we were sucking at treating pain. Now we're going back to that, but we were bad at treating pain. We took it on. Some of us felt pressured to treat pain better, but we started treating pain better. Now we have, you know, 25 million people in America treating their chronic pain with an opiate, and now we're going to take it away from them, and then they're going to go to bed and not work and not contribute to their families and become disabled, and it's a $625 billion drain on the economy, chronic pain itself, more than heart disease, cancer, and trauma combined. And so, and people don't know anything about it because, you know, if you're not having pain, you're not curious about it.
Mm-hmm.
You know, in fact, if you had pain before and you're not now, you don't even remember.
Yeah.
You know, so pain. Can I swear again?
You can
Okay,
swear.
all right, good. Pain's a fucking terrorist.
Pain is a fucking terrorist.
And people just get so terrorized by it, it just wears them down. And maybe after 10 years or 15 years, your adrenal glands have given up, and people die from chronic pain. Now, we have a myth in medicine that nobody dies from opiate withdrawal. But that myth came from dealing with heroin addicts that were young. You know, most heroin addicts are in their 20s. They're not, you know, it's hard to find a heroin addict that makes it to 30. But if you're 20 years old and you go into withdrawal, you've got a cardiovascular system that can tolerate it. But if you're a 50-year-old chronic pain patient and they take your pain medicines away, you've got a weaker heart, you've got a weaker organ systems, you've got a weaker brain, and you've got an ability to suddenly die from this lack of opiates. So this myth that nobody dies from withdrawal, I used to say that all the time to my ER patients that I wouldn't give them pain medicines to. And I couldn't write a prescription for, you can't treat chronic pain out of the ER.
Yeah, especially nowadays.
But I was really good at treating acute pain because I'd had a series of my own acute pains.
Mm-hmm.
Like I got really good at treating kidney stones when I had one.
Yeah.
Completely different about, oh, this one's writhing and sweating and complaining of back pain. Well, that's not a muscle strain, that's a kidney stone, you know.
Mm-hmm.
Bring that patient back, please.
Mm-hmm.
And so I think I digress a little bit, but if we could actually give doctors a chance to really assess the patients and create a relationship, we'll sort out who's gaming the system. It's not that hard to find out. It's hard on the first visit, but pretty soon it shows up that somebody's just trying to get the drugs from you, and then you cut them off, you know, and you got to do the right thing for them. And enabling people to be addicts is not the right thing for us to do.
Right.
But refusing care for there's 2.5 million addicts in America. Okay, there's 25 million people on opiates. There's 100 million people in chronic pain. You know, 100 million people in pain and 2.5 million that are addicts. So, you know, what we really got to do is put this to the right scale.
Right, and create that patient-doctor relationship better. And I see that, you know, you only get so much time, especially in the ER, with your patient. If I almost feel like if physicians were held to a higher standard, if they were held liable legally for the outcome of their treatment, I think that possibly doctors will be given more time with their patients, which would allow them to empathize more and get to know the patient a little better.
I'm gonna have to disagree with you there. We already are legally responsible for patients.
Okay.
You know, somebody takes an overdose of the methadone that I wrote for them for pain, I'm going to jail. Now that's crazy. If you don't take my prescription as directed, if you take all of it at once and die, most of those people are, you know, suicidal, and they've had it with their pain. It's not like it's an accidental. Chronic pain patients don't divert their pain medicine. They'd have to buy it back at 3 times the price.
Right.
And pain patients don't abuse their medicines unless they've had enough, and then they'll stash it up, and then they'll take an overdose and die. And you know, I used to say that suicide is a permanent solution to a temporary problem. But if you've got chronic pain and you've had it forever and you have no future to live into other than chronic pain, it can make you pretty desperate.
It can make you desperate because your life essentially has been taken from you.
Yeah, or a reason to live.
Yeah.
You know?
Yeah,
So-
your reason to live, you know you're gonna be broken for the rest of your life and there's nothing anybody can do.
Yeah.
I've watched a couple of your interviews and I've seen the patients that you've interviewed, and my heart just breaks for these people. And
Mine does too.
to bring light to those people and to bring light to the whole subject, encouraging other physicians to step out of the dark. You know, don't let your ego get in the way. Let's bring patient care back, and let's bring the care part back into patient. Let's care about them. Let's not just have them be another number. I think that's really important. And
Well, you know, one thing I've learned is that suffering leads to compassion. So my pain patients are some of the most compassionate people I've met. Doctors who go through trials are more compassionate usually, and so I'm not advocating suffering as a training program for compassion, but it just tends to happen in life.
Right.
And what I think that we all signed a Hippocratic oath to do no harm, and the problem with the Hippocratic oath is that it lets you off the hook if you're actually not actively treating somebody. So which then doctors say, I can't help you anymore, I can't be your doctor anymore. Well, that's abandonment, and we have rules about that. You have to have 30 days to get rid of a patient, that sort of thing. But you know, I don't think we're because everybody's trying to survive in this god-awful ego-based system. You can't expect a doctor to be both a policeman and a healer.
right.
You know, it's sort of being a parent, isn't it?
Yes.
Yeah, and so you know, we have way too much paternalism in our system already, and if we were more integrated or more cooperative with our patients, instead of saying, you know, I know everything and you know nothing, and your suggestions I'm just going to be, you know, most doctors have oppositional defiant disorder, right? You say,
Yes.
Doctor, would you give me this? Then that's the last thing they're going to give you,
Yes.
and it's like, that's not the right thing. I believe that the placebo effect is about 30%. 30% of people will have a benefit from a placebo. The alignment effect, this is just my idea, I don't have any proof of this, but the alignment effect is if you come to me with a suggestion and I align with it and it's not going to kill you, even if it doesn't work, you and I have built trust instead of suspicion. You know,
Yes.
he won't give me what I want. He won't give me what I need. He doesn't care about me. It's like, you want Prilosec instead of some other pill? Okay, good, let's try that. Maybe it'll work better because you're aligned with it. And then ultimately, if you come back to me and that's not working, then I have some credibility with you, and I can actually say, okay, this is how I would do it. Let's try this now. You know, we tried your way. You're the patient, you know, I'm your consultant, but if you want results, I would maybe try this instead. And then patients don't feel this sense of disempowerment, you know,
Yeah.
and that they're completely relying on a doctor's prescription, and they have to come back and beg for a pill or pee in a cup and all the kind of stuff that they have to do with your opiates and chronic pain.
Yeah, and I think you made a really good point. I think it's really important for patients to be able to have that trust with their physician, because you know, it just gives you an overall sense of well-being. Like, okay, I can relax a little bit. He does care. There is trust. We're gonna work this out, and
Yeah.
we've
She's
got
my
some kind of a
back.
plan.
Yeah.
Whereas, like, I'm gonna use my daughter for instance. When she had her brain surgery, they came out shortly after the very first MRI and told us they got 99.9% of the tumor. We were ecstatic, we were just thrilled, we couldn't believe it.
Yeah.
She went from having a 15% chance of even surviving the surgery to, let alone now they got all the tumor off of her brainstem. So then we get back to Missoula 3 months post-op, we do the MRI and it shows there's at least 3/4 residual tumor. And so for us, we felt really betrayed. We felt in a way we didn't know, was the pathology wrong on this tumor? Is it a glioblastoma instead of a pilocytic astrocytoma? Do we freak out? Do we stay calm? So,
well, that is the existential question right there.
Yeah.
Do I freak out or do I stay calm?
Mm-hmm.
Staying calm is always the best way.
Yeah.
But it's hard to do when your adrenal glands are pounding you and it's your loved one who's at risk.
Yeah, it's that fight or flight skill.
Yeah.
You know.
Or
so,
freeze. There's
yeah,
a third
or
one.
freeze. Yeah, that's.
Speaking of fight or flight,
Yes.
so I'm getting some signals that I got a couple patients out
Okay,
there.
so
And regarding trust, I can't violate the trust of
Right.
making them wait too long.
Right,
So
so
what do you want to do?
So how about we end the interview and we will let's plan on maybe doing another interview here soon.
Yeah.
I have a whole bunch of questions we didn't get to. I knew that once we got together it would just flow anyways. I just love Dr. Mark anyways.
Thank you.
We spoke together at Hemp Fest and he was at Hemp Fest a day after he'd gotten a stint,
Yeah,
correct?
yeah.
So this is an amazing man. I encourage you guys to look him up on YouTube and stay tuned for other interviews we're going to have. Thank you so much for taking the time. I know you're very busy, and I really, from the bottom of my heart, from all of my patients, thank you for coming out
I'm touched
and
by
bringing
that.
a
Thank
light
you.
to this.
Thank you. God bless
Thank
you.
you.
Thank you.
Thank you. And you guys have a great day. We'll see you next time. Until next time, peace, love,
Namaste.
and cannabis. Namaste.